Nurse TV, brought to you by HESTA and the Australian Nursing Federation.
Hi, I'm Sue. This is the Department of Diving and Hyperbaric Medicine at Fremantle Hospital. Okay girls, we've just got a phone call from Abrolhos. There's a diver that's had a rapid ascent. They're not very well. The RFDS is going to be on its way to Geraldton, so we'll just wait and see how long they'll be. It's a male. Most people would comprehend that we treat divers with the bends, but the divers are only really a third of our patient load. The rest where we need to increase the oxygen where they, for whatever reason, the healing is poor. It may be through infection, it might be through disease, or it may be through injury. Most of our patients are people that have received radiation therapy and they need to have further surgery in that area, or the area is not been healed after surgery. And the next big group of patients we have are diabetics with their leg ulcers. There are other various things that we can treat and have been shown to benefit. Carbon monoxide poisoning, most of those are attempted self-harm, but we do get the occasional accidental. In fact, we had one 2 weeks ago from an industrial site. Other things that has been shown to benefit with hyperbaric are some of the nasty infections like your gas gangrenes and necrotising fasciitis, which you sometimes hear about as being the flesh-eating germ, but really it's just a bacteria. And in fact yesterday we treated a lady with gas gangrene, so it is still around. Okay, and this is an anti-static bracelet, there we go. And what I'm going to do is I'm just going to slowly wheel the trolley in and see how you're going. All right, now I'm just going to be talking to you from the back. So it's very clear. You're not feeling closed in, except it is a little bit. How do you feel?
Yeah, I feel fine.
You'll feel fine. This chamber can be pressurised either on oxygen or on air. It is receiving the same treatment as the big chambers or the multi-place chambers. It is just better for some patients, particularly guys with the big leg fractures or things like that. We've just finished treating a gentleman that had a very big nasty wound all along his lower back, so we could position him nicely and comfortably on there. People with tracheostomies, with the holes in their necks, it just is a better way to treat them and more comfortable for them. And we've got a nice chair here for you. Just be careful of this step. It's a bit of a step. The floor's a bit slippery. A hyperbaric nurse, first of all, makes people feel comfortable going into a big steel room and having the air pumped into the chamber. It's very noisy. It can be a bit frightening. So we're there to make sure that they're happy and relaxed. They're able to equalise their ears because we're increasing the pressure inside the chamber. So how does it feel? It's not too bad, is it? I find your voice reverberates a little bit inside the hood, yeah. But the trick is to try and relax, and I'll get a book sent in so you can have a bit of a read. You can sleep if you like. Some of the patients are a little bit wary, a little bit frightened of going into these chambers, so that's the nurse's big role, is there to make sure that they're comfortable, relaxed and happy to be there for 2 hours a day. Some of our patients will need to come for 30 treatments, So that's 5 days a week for 6 weeks. So they need to be very happy and relaxed to coming. The other chamber system we have in our department here is affectionately known as Mildred and George. These were named by the British guys who installed it many years ago. We treat up to 4 patients in here, and in this chamber nurses go in with them and spend the whole 2 hours with the patient and look after their needs. As I said, they can be sometimes quite nervous, so if it takes holding their hand for the whole 2 hours, then so be it. At the moment we're treating a 12-year-old boy who has a short attention span, so there's lots of entertainment we need to keep involved there. We don't normally have divers that are very desperately ill, but every now and again we do, and we did have one that came in paralysed and he did walk from the chamber, so that was pretty exciting. There's an entry lock in between George and Mildred. If we have an emergency inside the chamber, it's sometimes best not to bring the chamber up because it'll put us at risk of having decompression illness. So it is sometimes more or beneficial that the doctor will come in and hopefully be able to solve the problem, and then the decision will be made what we're going to do then. I've been here 12 years and we've never had to bring it up in an emergency, but we've brought the doctor in quite a few times, yeah. We've had several patients over the years have been sent to us for assessment to see if hyperbaric can help, because the surgeon felt that these diabetics with these nasty leg ulcers, they wanted to take off their leg. One lady in particular, I remember, she was 70, she was already blind from her diabetes, and then they wanted to take her leg off. She came, she had 6 weeks of hyperbaric, and her leg was saved, and that was terrific. I like being a hyperbaric nurse because we have the time to talk to our patients. We can listen to what their problems are, and we then can perhaps talk to the social worker and get them some intervention. A lot of our particularly post-radiation people have problems with their eating, so we can observe and perhaps get dietetics involved. Yeah. So I think that's the nicest part, is that we are allowed the time to talk to our patients.